We are Maidstone.
Maidstone Radio.
Welcome to Sunday Brunch. I'm Cassie. I've got James and Georgia joining me from Involve Kent. Welcome to the show. How are you today?
Hi, thanks for having us. Yeah, I'm good.
Yeah, not too bad, thank you.
So, James and Georgia, you're a community outreach officer, James, and a community program and development manager, Georgia. What does that involve? That joke's going to be made a few times, I feel.
We've heard it so many times. Yeah. Do you want to go first?
Yeah, I'll go first. So basically what my job is I just essentially go out into the community and kind of talk to people, really, be that, coffee mornings, food banks, things like that. Basically where kind of any communities tend to gather, I kind of go out and hit the streets, really, and just kind of try and talk to people and engage with people. At the moment, kind of we're looking for communities that tend not to engage traditionally with, public consultation processes and things like that. So I'm out in kind of various different areas around Kent, just kind of really looking for people to talk to who don't really engage normally.
And Georgia?
Okay, so what do I do? My role, so I look after the community projects team here at Involve, which is a Maidstone-based kind of team. It covers community transport, wellbeing and inclusion work, cancer support, bereavement support. I look after a Help You Home service, which is hospital discharge based. So it's all about helping people get home safely and quicker. We also have a postural stability group that we run as well. So it's falls prevention, which is another kind of way of saying it. And all of those projects work together to kind of really, basically to combat health inequalities and be able to kind of serve the communities of Maidstone and kind of the surrounding areas to work towards kind of a healthier community.
So there's a particular project that you're working on at the moment that you mentioned. What is that all about?
Yeah, thanks. So basically what I'm working on at the moment is a project on behalf of KCC. We're doing, it's called Kent and Medway Listens. So we're looking at getting in touch with communities that don't engage normally, or people who don't have their voices heard often, to kind of inform decision makers about what people need in terms of mental health care. And we also want to find out how people's experiences were of the pandemic and things like that as well.
So essentially, like James says, the project is really aimed at serving those communities that aren't traditionally heard, and being able to kind of work with those individuals and ensure that what their views and their experiences of the lockdown and their well-being over the lockdown of COVID-19 is heard, to kind of improve those services around mental health services, and ensure that those voices are listened to, and that the service that we provide is a reliable one and a relatable one, and in line with what people really want, I suppose, rather than what we think people want. And we don't just want to do this as a one-off either. We want this to be a lasting kind of piece of work where some good will come out of it, and people will continue to kind of share how they feel and engage with their communities and engage with the kind of service providers to be able to make those choices and have that kind of healthcare that they want.
Particularly coming out of lockdown, where I guess you kind of might have formed a little niche by yourself in your house, and not so much want to engage with other people anymore. And people might just be threatened by the prospect of getting COVID. And
you just said it then, Cassie, about people's feelings of coming out of the home, because there's a lot of that. A lot of people are really nervous about going back out again, and lots of people feel, is it safe to go out?
I mean, when I went back to work after that first lockdown, I was just like, so after just one day I'm back in. Like, what was different about today than it was yesterday? I was just out back, like, with loads of people. It was just, obviously we were wearing masks, there were restrictions in place, but still it's just like, you're just walking around with people who might have COVID, and it was just very overwhelming.
Yeah, and I think that a big part of the well-being aspect was how people felt when they were cooped up at home, and lots of the services and resources that they would normally access, how they felt when that was withdrawn or taken away temporarily, and that was really hard. It was really, really hard for loads of people, and yeah, so I think it's really key to find out how people navigated that and what they did to help themselves and other people in that community as well, because that is something that could be shared in the future.
Have you had a really good response so far?
Yeah, I mean, James, you went to the Mila not that long ago, the Maidstone Mila.
Yeah, we got some really great kind of information from people at the Maidstone Mila. Myself and my other colleague Lucy, we've been kind of out and about in and around Maidstone and Tunbridge Wells as well. We've had some really kind of good conversations so far, so we're looking forward to kind of really getting into it a bit more as the project goes on.
Is this a typical project that Involve Kent would run, or is it a special one that's come about because of lockdown and COVID?
Yeah, it's a really good question. It definitely comes under our work. So this is a new project. Involve Kent is the wider organisation, as you know, that we're from. But our mission is healthy, connected people and communities. So this project naturally fits within that kind of vision. And it was something that came about from our understanding of how the lockdown has impacted people, but also wanting to learn more about that impact and what we might be able to do differently and supporting those kind of communities. So it fits within our services as a separate project, but one that we are working extremely closely with other members of the community on to kind of feed that information back.
And what other services does Involve Kent cover?
So Involve Kent, so we work out of, based in Maidstone, but we work kind of all over the Kent and Medway area. So our services include social prescribing, community navigation for social care, so older people and carers, community wellbeing services for the over 55s, including people with complex health conditions. We also have recently had the vaccination helpline service that comes under us, community engagement and support from the voluntary and community kind of sector. And we also have the community projects team, which works mainly out of Maidstone, which kind of tackles health inequalities and being able to set up groups and services that really tackle those kind of health inequalities.
So I guess you get a wide variety of people. I've had a look at some of the services. One I'm familiar with is the community transport, which I thought was really good, particularly good since a lot of people haven't been able to get around during lockdown, or not been able to connect with people. And there's children. Yeah, you were saying about children's services on there as well.
Mm-hmm. Yeah, we do have children's health and wellbeing services. Yeah, that's something else that we have involved here. And you're right. I mean, the transport service that you just mentioned there, I mean, it ties in really nicely to this project because the transport team that we have here worked tirelessly over the lockdown, and we were able to work with those most vulnerable. So whereas we normally provide transport as a standard, we were able to also do medication runs for people that couldn't get out of their homes. We were able to do shopping for people that couldn't get out of their homes because of COVID-19, and that service was invaluable to a lot of people that were completely isolated throughout the lockdown.
Because it has had a notable impact on mental health, being isolated and lockdown and everything. So you mentioned that you were targeting communities that are most vulnerable, people who are isolated and might not be able to get access to the help. You referred to it as seldom heard projects. Why was that?
Well, I mean, to help, to how I kind of think about it, and I think James does as well, is that really when we say seldom heard, that's people that are just not traditionally engaged with services, and that could be for a number of reasons. It could be because English isn't their first language, or it could be because they are socially isolated, or it could be that their community is one, maybe they're part of a religious community, and there's lots of reasons why people might not feel comfortable with sharing their opinion or their view, or naturally kind of wanting to respond and change services. So part of our work is to really kind of work with those people and find out what those voices are and find out what those experiences are, ones that we don't traditionally hear. And that could be for a number of reasons, lots of vulnerabilities and barriers.
And you mentioned you were at the Maidstone Mellor, wasn't it great? It was brilliant.
It was fantastic.
It was brilliant. Yeah.
The
rain at the end was not great.
No.
Literally, as we were packing down, the heavens opened, and I was just. Luckily, I brought a jacket, but
oh gosh, it was such a nice community engagement thing, and then a good event to set up at actually, and I'm glad to hear that you've got a lot of interest from that. If somebody wants to contact Involve Kent or the project that you've mentioned, how would they go about doing that?
So what we're looking to do really is kind of go out into the communities to kind of not so much find people as such, but kind of just wander out into the communities and kind of just come across people kind of naturally. But if anyone wants to kind of get in touch with us about kind of maybe organising an event or something like that, we do have an email address that they can kind of contact us on. So it's just outreachteam@involvekent.org.uk. So if people want to, if they want to put on their own event or they want to come along to an event that we might be at, that'll be the best way.
Yeah, and if anyone wanted, if anyone's got any kind of questions or wanted to reach out to us or share their views, like James said, that email's the best way to reach us, because we want to hear from people. We want to know how people are feeling. If something can be improved, we want to know about it because we want to be able to make that difference. And so, yeah, I mean, also the Involve Kent phone number, which I can find for you, is 03000 810005, and people can reach us via that as well.
That's great stuff. And thank you very much again for joining me, James and Georgia. If you'd like to learn more about Involve Kent, you can access their website, which is www.involvekent.org.uk. That's involvekent.org.uk.